My name's Funke Funke. My job role is a senior radiographer at Newham Hospital. I must have heard about COVID beginning of March, I think. Around that time. I can't remember the date now, it seems so far away. But it was around that time, query COVID, chest x-ray. What is COVID? And then more and more of it came. So over time, more and more requests for query COVID or requests to say, yeah, positive COVID, they want to check something else that is going on with the patient. So it was just more and more of these patients we kept seeing, and they were getting sicker and sicker. I think the most challenging part of COVID for me was the trips to ITU. It was emotional every time. No matter how many times I went to ITU, every time I turned up there, I just felt like, why are there so many sick people here? And there are always sick people on ITU every time you go there, but COVID time felt worse. Felt like everyone was sick and everyone was dying, and they couldn't do anything to stop these people deteriorating. It just felt really, I wish I didn't have to x-ray so many people on ITU all the time. Everything else I could sort of deal with, but that was maybe because I had to wear the full PPE and you couldn't really breathe properly and you couldn't see who was next to you. You didn't know who was who. Even the ITU nurses that I'm familiar with, I didn't even know if they were there. So it was all these strange faces everywhere, people coming in to help. So ITU was my worst experience of COVID. But I suppose ITU was the worst hit with all the really sick people. So the thing I'm most worried about now, apart from the second wave, which I think is imminent, is surviving a post-COVID depression. When the thought of what we went through during COVID times begins to come back to you, and you can't actually get up and live your normal life because you're worried about COVID-25 or COVID-68, something like COVID striking again and really hurting people you really care about again. During the pandemic, I was worried about how I was going to feel after the pandemic, and I was consciously looking after my mental health. As much as I was consciously looking after my mental health, I still felt like my mental health was lacking, because I felt like, why am I so upset? Why am I so withdrawn? And why am I so... The things I would normally do, I just can't be bothered to do. I just want to sit here and just worry about COVID, and not want to live. So I worry that post-COVID, would I actually want to get up and go out with my friend to Nando's? Would I actually want to get up and do the normal things I like to do? So I think psychologically, I have to put myself back in my pre-COVID state of mind somehow. I don't know how that's going to happen. What would I like to say to the people that donated? Thank you. Thank you so much, because at the end of this, if half of my colleagues that probably would have given up on life generally or on their career or X, Y, or Z, with this support, they feel, okay, I can go on with life, I can live, I can be a radiographer or whatever profession they're in, and I can lead a normal life, better even than pre-COVID. I think they should give themselves a pat on their back, because they've done this. The support people are going to get from the advice and the spaces and the help, the interactions, all this would be little drops that will end up making a mighty ocean in people's hearts, and it would help. So thank you.